Did you realize that by the time you finish watching this video, approximately 20 seniors will receive dementia diagnoses? That's one every 66 seconds. But here's the frightening reality. What if the cause isn't aging, but what's in your medicine cabinet? You've been told these pills are safe, routine, even essential. But emerging research is raising serious concerns. 99% of seniors remain unaware that at least one medication they're taking could shrink crucial memory centers in the brain by over 28% in under a year. Let that reality settle in. And the pharmaceutical industry, they've known about this for decades, yet they continue profiting billions from selling the same drugs that may be accelerating cognitive decline in millions of seniors. A 2023 study in Neurology and Aging Research found that one drug class increased dementia risk by 49% in seniors within just 2 years of use. This video reveals the 9 most dangerous medications triggering rapid memory loss and dementia, ranked from commonly overlooked to mind-destroying. Number 3 is prescribed to millions for something seemingly harmless, but it can shrink key memory centers in your brain, and you probably have no idea it's happening. Before diving in, share in the comments what medications you're taking daily, and have you ever experienced sudden brain fog or forgetfulness? We read every comment and reply with personalized insights. Don't remain silent. This could save your mind. Without further delay, let's start at number 9. Don't let its position mislead you. This one sits in almost every senior's cabinet and might be scrambling your brain before you feel it happening. Number 9. Diphenhydramine or Benadryl. Diphenhydramine is that pink pill millions trust for sleep, allergy relief, or cold symptoms. It's inexpensive, over-the-counter, and probably sits in your nightstand right now. You may think you're simply taking it for better sleep or allergy relief, but inside your brain, Benadryl can be disrupting the hippocampus, the region responsible for storing new memories. Benadryl belongs to a drug group called anticholinergics, which block a neurotransmitter called acetylcholine. This chemical helps your brain form new memories and maintain alertness. The older your brain becomes, the more it depends on every bit of available acetylcholine. When this drug interferes with that process, the results can be devastating. According to a 2023 Journal of Geriatric Cognitive Health study, seniors who used anticholinergic drugs regularly had a 54% higher dementia risk compared to those who didn't. How can you protect your memory? First, avoid anything containing diphenhydramine, especially if labeled PM nighttime or allergy relief. These are often just disguised Benadryl. If you're using diphenhydramine for allergies, newer non-sedating options like loratadine, commonly sold as Claritin, don't cross the blood-brain barrier and are much safer for long-term senior use. Never stop medications abruptly, but never assume over-the-counter means safe. Number 8. Proton pump inhibitors. Prilosec or Nexium are medications belonging to the proton pump inhibitor or PPI class. These drugs reduce stomach acid and are often prescribed for heartburn, GERD, and acid reflux. Many seniors stay on them for years, even decades, because symptoms return upon stopping. What's rarely discussed is how PPIs interfere with vitamin B12 absorption, a crucial nutrient that protects the brain and supports memory, focus, and mood stability. In a 2016 JAMA Neurology study, researchers examined over 73,000 people aged 75 and older and found regular PPI users had a 44% increased dementia risk compared to non-users. By suppressing stomach acid too aggressively, PPIs interfere with the body's ability to absorb not just B12, but also magnesium and calcium, essential for neural transmission and brain cell signaling. Without them, neurons struggle to fire efficiently, causing misfiring, confusion, and memory lapses that often mimic early Alzheimer's signs. PPIs have also been shown to increase amyloid beta plaque levels in the brain, toxic proteins that disrupt brain function and are considered core Alzheimer's drivers. There are safer alternatives. If you're using a PPI daily, Ask your doctor whether you can taper off slowly with H2 blockers like famotidine, sold as Pepcid. While not perfect, H2 blockers are less likely to interfere with cognition. Also, chewing deglycyrrhizated licorice, a natural compound that coats and soothes stomach lining, can offer symptom relief without cognitive harm. Number 7. Bladder control medications. Oxybutynin, sold as Ditropan, is often prescribed to seniors struggling with urinary incontinence or overactive bladder. On the surface, it seems like a practical solution. Nobody wants to deal with frequent bathroom trip embarrassment or inconvenience. But this medication works by blocking acetylcholine, the same brain chemical disrupted by Benadryl. Unlike some milder anticholinergics, oxybutynin crosses the blood-brain barrier more easily and directly affects hippocampus memory regions, making it particularly dangerous for seniors, especially with long-term use. In a 2019 BMJ study, researchers found that people over 65 who took strong medications like oxybutynin for more than 1 year had a 49% higher dementia risk. That's nearly 1 in 2. What makes it more concerning is that many seniors never receive warnings about cognitive side effects. They're simply told it will help bladder control, not that it may accelerate mental decline. The harm often gets mistaken for normal aging. Patients describe feeling foggy, forgetting appointments, misplacing items, or suddenly struggling to track conversations. It's rarely linked back to the medication until damage has progressed. If you're taking oxybutynin and have noticed mental changes, it's not imaginary, and you don't have to stay on the drug to maintain control. Fortunately, newer medications like mirabegron, sold as Mirbatric, work through different mechanisms and show significantly less memory impact. These drugs don't block acetylcholine and are generally considered safer for older adults. Number 6. Statins. Statins are among the world's most widely prescribed drugs, especially for people over 60. They're meant to lower cholesterol and reduce heart attack and stroke risks. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are the two most common ones. But here's where problems begin. Cholesterol isn't just a heart issue, it's a brain necessity. The brain consists of nearly 60% fat, and cholesterol plays a key role in creating and maintaining the myelin sheath, a protective coating that helps nerve signals travel smoothly. When you aggressively lower cholesterol, you may also be starving the brain of what it needs to function. In a 2023 Frontiers in Aging Neuroscience study, seniors over 70 who had been on statins for more than 3 years had a 26% higher mild cognitive impairment risk. And those on high doses had even more noticeable declines. Some patients reported sudden onset memory loss, describing moments where they couldn't recall names, recent conversations, or even familiar driving routes. Not all statins affect the brain equally. Some, like pravastatin and rosuvastatin, don't cross the blood-brain barrier as easily and are considered less risky regarding cognitive side effects. If you've been on a statin for years and are noticing fog, forgetfulness, or confusion, it might be time to discuss dose reduction or alternative strategies with your doctor. Don't wait until it becomes irreversible. Earlier action provides better chances of protecting your mind for years to come. Number 5. Benzodiazepines. Benzodiazepines, including drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are among the most widely prescribed medications for anxiety and sleep problems. They work by enhancing GABA, the brain's calming chemical that reduces overstimulation. Initially, they seem like lifesavers, quieting the mind, easing panic, and helping with sleep. But over time, these drugs become something entirely different: a trap. A 2022 BMJ study followed over 8,000 seniors over 6 years and found that those who used benzodiazepines for more than 3 months had a 51% increased Alzheimer's disease risk. Risk went even higher for long-acting benzos like diazepam, which stay in the body longer and accumulate in fatty tissues, including the brain. What happens is a kind of chemical sedation that slows neural activity. Your brain stops learning as quickly, becomes less flexible, less efficient, and more prone to confusion, memory gaps, and emotional dullness. Seniors on benzos often describe feeling foggy, disconnected, or just not themselves. The worst part is when they try to stop. Withdrawal symptoms like anxiety, agitation, and insomnia can be severe, making the drug feel essential when it's actually the problem source. If you've been on a benzo for more than a few weeks, don't stop suddenly, as this can be dangerous. Instead, work closely with a doctor to taper the dose gradually. Alternatives like buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety can help restore calm without causing memory loss. Number 4, amitriptyline or Elavil. Amitriptyline, sold as Elavil, is an older antidepressant still commonly prescribed today for pain, insomnia, and sometimes migraines. At first glance, it may seem like a multi-use miracle pill, but underneath, it's one of the most potent anticholinergic medications still in circulation, meaning it blocks acetylcholine action, the chemical that helps neurons communicate, form memories, and stay sharp. It blocks it so strongly that cognitive effects aren't just possible with long-term use, they're expected. In a massive 2015 JAMA internal medicine study, researchers examined over 3,400 adults aged 65 and older and found that those who took higher cumulative anticholinergic medication doses like amitriptyline over a 10-year period had a 54% greater dementia chance. That's not just a slight increase, that's more than half again the normal risk. What's terrifying is that many patients weren't told the drug could harm their memory. They were often prescribed amitriptyline for sleep issues or nerve pain, then slowly began noticing changes like short-term memory loss, word-finding difficulties, and foggy concentration. It doesn't require high doses to cause problems. Even low-dose amitriptyline taken nightly over several years can create slow, invisible brain power erosion. The damage happens silently with no warnings, no initial symptoms, just gradual decline that looks like aging but is actually drug-induced cognitive impairment. If you or a loved one is on amitriptyline, speak with a physician about alternatives. For nerve pain, options like duloxetine or gabapentin may offer relief without the same anticholinergic burden. For sleep, melatonin or low-dose doxepin, which has a much milder anticholinergic profile, can be used instead. For mood support, newer antidepressants like sertraline or escitalopram are generally considered safer for the brain. Before we continue, if you're finding this information valuable, please hit the like button and don't forget to subscribe so you won't miss more important health content like this. Number 3, paroxetine or Paxil. Paroxetine, sold as Paxil, is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for depression and anxiety. At first glance, it appears to be a modern antidepressant, one supposedly gentler than older generation drugs. But here's what they don't tell you. Paroxetine is the only SSRI with significant anticholinergic properties, meaning it interferes with brain acetylcholine. That one detail makes it drastically different from its SSRI siblings like sertraline or escitalopram. In a large 2021 Frontiers in Psychiatry review, researchers examined elderly patients' cognitive profiles taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within the first 12 months. The study also found seniors on paroxetine were 30% more likely to show early cognitive impairment signs compared to those on other antidepressants. The irony is that it's often prescribed to stabilize mood, yet it ends up undermining mental clarity and emotional regulation over time. The fix here is straightforward but essential. Avoid paroxetine entirely in seniors. The American Geriatric Society has placed paroxetine on its Beers criteria list, a list of medications potentially inappropriate for older adults. If you're on it, ask your physician about switching to safer alternatives like sertraline or escitalopram, which are better tolerated and don't carry the same cognitive risks. Additionally, supplementing with B vitamins, especially B12 and B6, can help support mood naturally. Number 2, antipsychotics. This one is especially alarming because many seniors don't even know they're taking an antipsychotic. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were originally developed to treat schizophrenia and bipolar disorder. But today, they're frequently prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes associated with dementia itself. That's right. These drugs supposed to be for severe psychiatric illness are being used in nursing homes and hospitals for seniors who are simply confused, restless, or hard to manage. The consequences are devastating. In 2022, a comprehensive Lancet Healthy Longevity study followed more than 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within 12 months, even with no prior dementia history. Worse, these drugs increase stroke, sudden death, and severe sedation risks, which can lead to falls, hospitalization, or permanent institutionalization. The mechanism is brutal. These medications suppress dopamine, a chemical linked not only to mood and motivation, but also critical for executive function and memory processing. When dopamine levels crash, the brain becomes sluggish and unresponsive. This is why seniors on antipsychotics often appear dull, emotionally flat, or zombified. Their personalities fade, and family members begin mourning someone who's still physically present. Correcting this situation starts with asking hard questions. If you or a loved one is on one of these medications, ask the doctor why it was prescribed and whether it's truly necessary. In many cases, behavioral symptoms can be managed with non-drug interventions, creating structured routines, reducing noise and overstimulation, addressing pain or discomfort, and improving lighting and sleep hygiene. When medications are absolutely necessary, lower doses for shorter periods can reduce harm. But more often than not, these drugs are used out of convenience, not necessity. The tragedy is that many families aren't even told what these drugs do. They just see their loved one declining without knowing the cause is chemical, not natural. Number 1, anticholinergic polypharmacy. This is the hidden danger almost nobody discusses, and it's one of the biggest contributors to drug-induced dementia in the elderly. You may expect a single drug to top this list, but the most dangerous medication for rapid dementia in seniors isn't one pill. It's the silent, creeping effect of taking multiple medications with anticholinergic properties simultaneously, a situation known as anticholinergic polypharmacy. Imagine this scenario. A senior takes diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each one alone may cause only mild memory problems, but together they compound and the cumulative anticholinergic burden skyrockets. This isn't just theoretical concern. In a 2022 age and aging analysis, researchers tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased dementia risk within 10 years. That's more than double the risk. Here's the worst part. Most of these seniors had no idea they were even on anticholinergic medications. When you block acetylcholine from multiple angles simultaneously, your brain doesn't just slow down, it begins to decay. Neurons wither from underuse, synapses shrink, and the brain enters a hypoactive state that mirrors Alzheimer's. Correcting this doesn't require a miracle, it requires a medication review. Ask your doctor or pharmacist to evaluate your complete list of prescriptions, over-the-counter drugs, and even supplements for their anticholinergic load. Online tools and professional software can calculate cumulative burden. Once identified, you can work to deprescribe, slowly tapering off unnecessary medications, switching to safer alternatives, and rebalancing brain chemistry. This is the most empowering part of this entire video. Drug-induced dementia is often reversible. When the burden is lifted, many seniors regain clarity, energy, and memory function within weeks or months. The brain is resilient, but only if you give it a chance. Polypharmacy isn't just dangerous, it's preventable. And that makes it the #1 hidden medical threat to our aging population's minds. We want to hear from you. Which of these medications are you currently taking? Have you noticed any brain fog, forgetfulness, or personality changes since starting a new medication? Are you willing to talk to your doctor this week about reviewing your medications? Share your experiences and opinions in the comments below. We love hearing them. Thanks for watching.